She dropped the phone and burst into tears. The doctor just confirmed her fears. Her husband held it in and held her tight. Cancer don't discriminate.
My name is Hillary Hom. I'm a medical oncologist.
Hi, my name is Lynn Castleberry. I was at the age of 62 when I discovered I had breast cancer.
I was only 38.
My mom had breast cancer 3 years ago. That's when I found out, and I was 12.
Hi, my name's Tony Oliver. My wife got diagnosed with breast cancer in December of 2007.
The majority of my patients have breast cancer.
I had just took early retirement from my job the year before to watch my youngest granddaughter, and I had got to be with her for about a year and a half when I found out I had cancer.
I went to go have a mammogram, which was my second one.
In terms of the women that I take care of, I think that having a breast cancer diagnosis for most of those women is really the scariest thing that they've ever faced in their life. That this is a cancer diagnosis for anyone is life-threatening.
I did go through 9 chemotherapies, which was every 2 weeks. And 2 months after I finished the chemo, I went through 28 sessions of radiation. I had finished this up in May of 2009.
It didn't really get to me until she got her first surgery, and then it all hit me hard because I thought I was going to lose my mom.
So when a woman has breast cancer, that obviously affects her, and it really affects her friends and family members as they help her go through this experience.
And I wasn't expecting anything to be wrong because I'd already had one, but my regular doctor said that he saw something, and he made me go get a digital mammogram, and then the digital mammogram wasn't conclusive, so they made me go to my breast. They set me up with a breast doctor, which was Dr. Corrigan. She did a biopsy to see if, it was cancerous, and then on December 6, 2007, they told me I was going to have at least one mastectomy. My whole right breast was covered with, it's called ductal karma instigus, when your milk glands are cancerous, and they said it was 99% hormonal.
During my weeks of radiation, I went to my sister's on Sunday before I had my chemo treatment on Monday, and I stayed with her for a week. And then I returned back home and stayed a week, and then I did that all over again until I finished up my chemo. After the second treatment, my hair all started coming out, so I went on to the beauty shop and got my head shaved.
It was devastating news. We had to go through 16 operations in 3.5 years. We were there. I was there for all the operations. It was really tough.
I think the most important thing is that they have to have a team of physicians and health professionals that they feel comfortable with, that they can communicate well with, so that they can help them address all their decisions and make the best decisions to manage their breast cancer. The woman also, though, has to really have the emotional support from family and friends, and I think the emotional support really from the providers of her care. And so she has to be in a situation that she feels comfortable with all the people that are taking care of her.
I did have lots of family support. My children and my grandchildren was just extra sweet.
When I went to go get my results in December, my husband and my mother-in-law were with me. We weren't expecting them to say I had cancer, but the lady came in and told me that she wasn't going to like her very much. And anyway, my cancer was really big. My oncologist took it to a cancer seminar, and she's always told me that there could be one cell that they missed because it was so big. I mean, I chose to have the double mastectomy to lower my chances, but my doctors will never tell me that I'm okay because it was so big. And whenever you have cancer, they'll never be able to tell you that everything's okay.
I had a mastectomy on my right side due to the cancer. It was in 9 of my lymph nodes. And because of that fact, I can't allow anybody to take any blood or blood pressure in my right arm. Sometimes people don't believe me. I'd had a stroke a few months after I'd finished all my treatments, and I had to argue with the attendant in the ambulance because they was going to use my right arm, and I told them they couldn't.
So I've had, in all, I've had 16 procedures. They made me have a colonoscopy, which was awful. And instead of every 10 years, I have to have it every 5 years. I go see my oncologist every 6 months to test my blood. And like I say, I have to be on the tamoxifen for 5 years. So it's just, a process that we have to go through.
Now, the impact on their life emotionally, I think, is something that stays with them forever.
I did wonder what I had done that caused this to come on me. I've always tried to be a good person, but sometimes that's not the way it falls in. But cancer has no bearing on what sex, what kind of person you are. If you're mean and cruel and drink or cuss, or if you go to church, that don't have anything to do with when cancer gets in your body.
And certainly the patients that have supportive friends and family really also, look to those people in their life to help them get through this. And there are also support systems and support groups that women will also tap into to help with their emotional needs during treatment.
Each time that I hear the word cancer, that makes my heart skip a beat, because some people that I know that had breast cancer since I had gone through mine was not able to overcome. Lots of folks has had a lot worse time than I did, so I try real hard not to feel sorry for myself because I know it could have been a lot worse. Cancer is just a scary word.
Seems like after we went through all the operations and everything, it was just we went through the motions of them. You don't really have time to prepare or look at what's going on. But then when you're done with the 16 operations, then you have a time to reflect and look back. And that's when it seems like that's the most hardest for Michelle now, because she has a time to look back and it's depressing to her.
Most women who go through treatment for cancer, especially if they require chemotherapy, are very happy to see their treatments come to an end, very happy to have their life go back to normal and for them to feel 100% physically. But I think the worry and their experience with cancer is something that they never leave behind.
And it made me really depressed. And just now I started taking therapy for it. And now that I realize that everything will probably be okay, and that I'm not having to go to therapy anymore, that my mom will be okay, that's just all I have to think and be positive about it, and not think she's going to get cancer again.
Now, although I am not a patient myself, I have done this for over a decade, and I have treated many women with breast cancer. And for all of them, it's a frightening experience, but I think that for the majority of them, they find a strength within themselves that I'm not sure they knew they had.
But But it seems like things are getting better with a little bit of therapy and everything, and she seems to be doing a lot better now, and we have to take the cancer medicine for 5 years, and I think she's almost down to maybe 2 years left, and she's still cancer-free.
I'll have to go see a therapist because it has brought me into a depression because of the way I see myself, but others, are okay. It's just me, and my therapist tells me, it's just something I have to overcome. But, it not only the physical aspect of having cancer, but the mental is really hard too. It's not only hard on yourself, it's hard on your whole family.
Now, for a lot of those women, they feel that cancer has a positive side as well, that they, because they've gone through cancer and experienced the treatment, they kind of look at life differently than they would have normally. A lot of women will say to me, I just don't worry that much about the small things. Cancer has taught me really what's important in my life, and it's friends and loved ones and making sure that I live my life fully. Now, I don't think any person with cancer would choose to have cancer to learn those life's lessons, but I think it is one of the positive things that a lot of people take away from their cancer diagnosis.
And I don't know what else to say.